Assessing perioperative outcomes of holmium laser enucleation of the prostate following prior benign prostatic hyperplasia procedures. HOLEP has been described as a size-independent technique that has been utilized for patients with persistent voiding dysfunction following other BPH procedures. In this video demonstration, we describe our technique for selective middle lobe enucleation in a patient with bothersome lower urinary tract symptoms and extreme pain with ejaculation following a prior prostate artery embolization. Office cystoscopy had demonstrated a calcified and necrotic median lobe. Upon entry into the prostatic fossa, we encountered necrotic tissue arising from the median lobe. We bluntly delivered this into the bladder. His lateral lobes did not appear to be obstructive. We used a 550 micron Moses holmium laser fiber to perform lithotripsy on this tissue. We returned to the verumontanum and bluntly created a plane between the left and middle lobe. We then released the middle lobe from the verumontanum. We used the laser fiber to incise the plane between the left and middle lobe, and this was carried down to the surgical capsule. We then performed a similar dissection between the right and middle lobe. The middle lobe is released from the posterior capsule. When in the appropriate plane, the adenoma will peel easily with blunt dissection. The adenoma is released from the bladder neck. We use the Wolf piranha morcellator to evacuate the adenoma. At the conclusion of the case, the patient has a non-obstructive, wide-open channel. At 3 months post-operatively, the patient reports significant improvement in his voiding symptoms. He ejaculates without pain and has marked relief in his symptoms. Examining our own data, we found no significant preoperative differences between patients that underwent a HOLEP following a prior BPH treatment as compared to patients that underwent HOLEP as their first BPH treatment. Most patients underwent a prior transurethral resection of the prostate. We performed logistic regression and found no statistically significant association between treatment with a prior BPH procedure and a patient's improvement in AUA symptom score and return to urinary continence. Hence, patients that are treated with HOLEP as a second BPH procedure achieve the same functional improvements in AUA symptom score and return to urinary continence as compared to patients treated with HOLEP as their first BPH treatment.